All right, so let me go from the very start. Okay, let's see. I mean, this is very simple, and I'm trying to explain this from the very, trying to make it very easy. Okay, so many beginners are also there, and most of you are students. So some of some of you might have already come across all these terms. I mean, not this one, but other terms which is used in molecular docking. But let me just give you a whole level playing field. Okay, so let's see what is a disease, right? So disease is any condition that disrupts the normal function, body function. Often it is characterized by specific symptoms like fever, inflammation, fatigue, respiratory issues, etc., right? So what causes a disease? This can be, disease can be caused by two factors. So one is the external factor, which involves the infection through various pathogens such as virus, bacteria, fungi, right? And it can be through internal factor also, primarily due to the body malfunction, including genetic mutation, which can lead to, cancer, and also due to autoimmune responses, etc. Right? So when you are sick, what you can do, or what are the intervention you can take? So disease intervention include taking uh, medical treatments like taking medicines, right? And sometimes you go for surgeries, then you go for lifestyle changes, such as doing dieting exercises, etc. But most of the time, we take medicine, right? When we are seriously ill, so we take medicine in the form of a drug. So let's see what is a drug and how does it work. So drug is a biological or chemical entity that can modulate the course of a disease state by interacting with a specific molecule called the drug target. Okay, those who are new to this, I mean, please pay attention. Okay, so some terms will be defining here. So those terms are very important when you do molecular docking or when you deal with drug discovery process or pipeline. Okay, so drug is a biological or chemical entity that can modulate the course of a disease state by interacting with specific molecules called the drug target in the body, right? Either enhancing or inhibiting their function, ultimately altering biological processes and producing therapeutic effects, leading to physiological responses that alleviate the symptoms or treat the disease. Right? So let's say this is a drug molecule, right? So a drug molecule can be what? Biological, like vaccines or antibodies, right? Or it can be chemical entity. So drug can also be synthesized, right? So small molecules, Most of them are organic, right? They can be synthesized or they can be by, uh, you know, uh, created biologically, right? Like the vaccines or antibodies, right? So, so this drug molecule can modulate the course of a disease state by interacting with a specific molecule called a drug target. So there is something called a drug target where this drug molecule will interact. Okay, so when they interact, they they undergo changes, right? So when this drug molecule again, when they interact, it can, you know, inhibit or enhance the function of the drug target. So when they enhance the function of the drug target, so the drug molecules are called as the agonist. Okay, so drug molecules, when they interact with the drug target, and due to those that particular interaction, if the drug target function got enhanced, then it is called as the agonist. The drug molecule is called as the agonist. Okay, if the interaction inhibits the function of the drug target, then the drug molecules are considered as antagonist. Okay, so if they inhibit, then it is called as antagonist, and if it enhances the function of the drug target, then it's called as the agonist. Okay, so when they modulate the function of the drug target, it brings changes and it can lead to a therapeutic effect. So this therapeutic effect can be in the form of, they can alleviate the symptoms. They can eventually treat the disease, right? So we have the drug molecule binds or interact with the drug target. So it undergoes some changes when the drug binds to the drug target. When it enhances the function, it is the drug molecule is called as the agonist. If it is inhibit the function of the drug target, it's called as the antagonist. And due to the modulation of the drug target, it can result into therapeutic effect, leading to alleviation of the symptom or sometimes the complete treatment of the disease. Right? So with this understanding, we can again take one example. Okay, so let's take the example of Alzheimer's disease. So Alzheimer's disease is a progressive neurological disorder that can cause brain cells to degenerate and die, right? So what are the main symptoms? Memory loss, progressive impairment in rational thinking, and behavioral impairment. Okay, what are the pathophysiology that we observe in Alzheimer patients, especially in the brain? So we see the neurofibrillary tangles, neurofibrillary